Good afternoon. I'm Michelle Demoy, Deputy Director of the Consumer Privacy Project at the Center for Democracy and Technology. I'm really pleased to be here today to talk about a really important and provocative subject, and that is data breach and medical identity theft. And I have some amazing panelists here today who agreed to share some of their expertise with you and me. First, I have Renee McIver, who's the Chief Security Officer at SecureKey. Bob Gregg, Chief Executive Officer at ID Experts. Manisha Mithal, Associate Director, Division of Privacy and Identity Protection and Bureau of Consumer Protection at the Federal Trade Commission. That's a very long title, Manisha. Ann Patterson, the Senior Vice President and Program Director for the Medical Identity Fraud Alliance. And Josephine Wolf, doctoral candidate. Are you still a candidate? Or are you
maybe headed tomorrow? So
okay, candidate almost, doctoral finalist. I don't know, what do you call that? Just doctor. Doctor at MIT and a fellow at Harvard's Berkman Center for Internet and Society. So one of the things that I wanted to preface this conversation with is the cost of data breach and health. Cyber criminals are increasingly targeting medical records and financial data around the globe, and companies are finding that the average cost of data breach has been just skyrocketing. It now tops $3.8 million on average, according to the Ponemon Institute. They actually just came out with something on Wednesday. And they said this represents a 23% increase in levels seen just 2 years ago. It's not something I probably need to tell any of us. All you have to do is read the news on any given day. One of the interesting parts of this study, which actually included responses from 350 companies that experienced breaches spanning 11 countries, so this is not just a United States problem. It found that the average cost for each compromised record was up 6% to $154 a record. And in healthcare, that number goes up to $363. So I guess I want to reference the title, which is low-hanging fruit. And I think actually, Anne, you coined that phrase, and I saw that, and I thought it was an interesting way to frame this conversation. So I want to ask each of the panelists, why do you think that data breaches continue to occur from both a privacy and security perspective? And is health data low-hanging fruit? Renee.
So in preparing for this question, I actually went and started looking at some of the data breaches that have been happening and looked specifically at the top 5 that are listed in one of the data breach sources I was looking at. And there is a significant percentage of them that are just attributed to theft. And then when you look at what the theft is, it's laptops, desktops, email is part of the theft. Some network servers, but mostly those are often in conjunction with unauthorized access. So it seems to me that there's a lot of information that's sitting out on all of these servers, desktops, laptops, portable devices like backup tapes, unencrypted. So maybe that's a good start. And one question I kind of have, because I'm not in the privacy space, I am in information security, but in the identity space, in my organization, we have services that are subject to PCI, because we have some payment services, and FedRAMP, because we have some U.S. government services. And so those are information security requirement standards that we need to be assessed against. Do the healthcare industry have similar information security requirement, assessments and certifications that they actually have to do? I don't know the answer to that.
Does anyone want to comment on that? Or know the answer to it?
Well, I would say that there's no question that financial services is way, we commonly say financial services when it comes to security and privacy is 7 to 10 years ahead of healthcare. Mm-hmm. And we see it every day. Mm-hmm. Just on the original question, I think for this group, what's really relevant is healthcare data breaches. And, it's not lost that it wasn't that many years ago a healthcare data breach was some doctor or nurse showed your file to 6 or 7 other people, and that was a data breach. Now, Anthem, 3 months ago, announced 80 million people in a single breach in a single day. Followed weeks later with Primera, followed weeks later by CareFirst here in the Northeast. So why it's happening is, back to your quantum study, one of the things they found was 125% increase in outside hacks into healthcare databases in the 5 years that we've been doing the study. So Why? They don't really want your diagnosis data. They don't really care if you've got bad knees or not. They want your medical identity so they can harvest that and monetize it, take it out and either perform medical ID theft, classic medical ID theft, or sell it to a third party that has a provider number and can bill against that medical ID all day long without performing any services. And it's a several billion dollar industry every year in this country. So that's the why. And I always like to note that a medical ID on the internet, on the dark internet, is, according to the FBI, anywhere from 10 to 25 times more than a physical ID. So there's a reason medical information gets better.
And why is that? Why is it more valuable?
The ease of monetization. I mean, think about it. You get somebody's credit card, that's going to last as long as somebody reports it and then they get a new card. You get somebody's medical ID, you've got that ID for basically their life. Unless they're paying really close attention, they won't know about it for months, quarters, years.
Not to mention the fact that the financial industry is sort of incentivized to stop these sorts of things because they have to pay. What if that's not the case? Nisha.
Yeah, so I just, in thinking about this question, I think there's kind of three things that are unique to data breaches in this space. I think one has already been touched on, the idea that there are small merchants out there, and even if you're a small merchant accepting credit cards, you have to comply with PCI standards. Whereas you have doctors' offices and dentists' offices and a lot of small businesses here who are collecting SSNs and other highly sensitive information, and there's a less regulated environment. I think the second issue is that I think there's a lot of insider theft in this area. You have a lot of people laying hands on this data. You have your doctor's offices, you have your insurance companies. For the elderly, you may have nursing homes. For kids, you have their schools and their physical forms and their health records. So I think there's a lot of hands that touch data. And I think to that point, I know we've seen stories where there's companies to whom medical services have been outsourced, and they threaten to expose personal data as a way to get the medical provider to pay. So I think blackmail and I think the privacy concerns are also pretty stark in this area. And I think finally, medical records have Social Security numbers, and so those are not just used for medical identity theft. Social Security numbers are the keys to the kingdom. They're used to open up new accounts, credit card accounts, mortgages, and they can be used to commit financial fraud. So it's not just health information being stolen for health purposes, it's health information, or it's Social Security numbers from health records being stolen for a variety of purposes.
So I agree with everything that's been said. I do think when you say why does it happen, why is it considered low-hanging fruit, I don't know if I quite coined that phrase. So one of the things that I think is that, we, like right now, we're talking about it, and so whether it's how much of it is the reality and how much of it is perception, but we continue to say that healthcare is a low-hanging fruit. So to the extent that we keep saying that, it will keep being, perceived as that with the bad guys, right? But in some senses, it is a convergence of different things. We have, since the move to EHR, since high tech, a huge amount of cyber EHR coming online that now maybe was only before open to paper-based attacks, which might have been a little bit harder if you're trying to do things like, just dumpster diving or things like that. But when you move into obviously the cyber world, you've opened more attack vectors there. So the huge amount of EHRs that are coming online, what Bob mentioned, the whole monetization part of it, and some of that as as we become millions, and we're already at I don't know how many hundreds of millions of health records, with like 80 million just in one shot from Anthem. But as the number of healthcare breaches sort of kind of catches up to retail and financial services, because that's kind of where the crooks had jumped to that channel. Some of that might change a little bit. So, with the supply and demand, there is still the element that, like Bob mentioned, about you can close your bank account, credit card immediately while you're on the phone. As soon as you see a fraudulent charge, it's closed. But, who here is going to close their birth date or change your Social Security number? So things like that, obviously. Those conditions still exist, so there's that convergence as well. And then, organized crime will, even if you say just within financial services sector, they experienced things that were, check fraud, right? Check 21, we electronified that, ATM fraud, then you started online banking, and, crooks jump to that channel, then that gets locked down, and then you start mobile banking, and then you jump to, so the bad guys are going to jump channel to channel to find what they perceive to be the low-hanging fruit. And, healthcare will be the same in terms of, when you think about the Internet of Things, like, it was mentioned that they're not after the fact that you have bad knees, in that Internet of Things where everything is network enabled, they're not trying to steal the x-rays, but they're using the x-ray that's network enabled so it can communicate your information, your health information. So that's the purpose of being network enabled, but they're using that as a point of entry. So again, with the convergence of the amount of data we're creating, the amount of electronic PHI versus paper-based PHI and EHRs, you've got, the whole Internet of Things with the mobile. BYOD is a little bit of a newer, from a policy standpoint within the healthcare industry compared to something like, again, financial services like banking or retail, where there are still many organizations that don't have very thought out or very robust BYOD policies. And I want my doctor to be able to access my information on his phone if that's going to help him save my life. But at the same time, as a privacy person, I'm, aware of the fact that, well, okay, how did my data get to his phone and then what happens to it, right? And so as a professional, we're concerned about, our data and where it is, but then as a patient, we do want some sort of ease of access for our healthcare. And so things like BYOD, I know there's been some talk today about wearable devices. And so this whole interconnected world we've created converged with the amount of data we're creating, and some of that data we're creating ourselves, right? We do, just now we heard about social media type kind of, that you provide the information. You're consenting to the information being put out there. So when my sister is talking about my niece's health, which I think is just a huge invasion of my niece's privacy, but when she's talking about that on Facebook, and my niece is 8, right? So she didn't consent to her personal health information being out there on Facebook for my sister to do, but when, we are, I guess, consenting because we volunteered that information out there in that domain. So there's all this convergence of
And actually,
data we're
a
creating.
couple things, sorry, but one thing, because you're bringing up some really interesting points, I think, especially the first point would be on wearables. And I'm curious, how vulnerable are we to a data breach in wearables? As far as I know, that hasn't occurred. I don't know if anyone in the audience is aware of it. And if that's the case, why hasn't that occurred? Does anyone have an answer?
I would not be surprised if it's imminent. Like when it happens, I don't think I'll be like, oh my gosh, it happened. I don't think anybody here will be surprised, right? When it happens, we'll be like, well, oh, it happened.
But again, it's what data are you after, right? I've got my Fitbit. Anybody who wants to know what's on this, I'm so happy to have it right there. If I have my medical identity on here, if I have my bank account, then I'm concerned.
Right. And so much of it depends on the device itself, right? Because Fitbit has sort of an access control that it's going to view. And then it's really the app. And this is probably often the case. That is the vector of security, vector problem.
And not, so that's a wearable where it's more privately with just you, but, there are other medical device wearables that are between you and your physician, right? And so where, like maybe a heart monitor or pacemaker type kind of things where it is transmitting over cyber, it's transmitting data to your physician, and then it becomes, well, what's that, that transmission channel? Who's the vendor my physician's using? From a channel security that data is going back and forth now and transmitting my data, and presumably the data contains some kind of identifiable information so that it can identify those pacemaker things with that kind of person.
So I just wanted to add that we hosted an Internet of Things workshop a year ago, and we did have some security researchers who'd done some proof of concept type hacks. And so, for example, we had one panelist who talked about the fact that he was able to hack into a popular insulin pump And the idea that he was trying to show is that not just can you get the data from the insulin pump, but you can actually interfere with the medication that's being provided. And so it's not just about data breaches. I think it's also about just breaches generally that could affect healthcare and the health you're trying to provide the person. And so, maybe it's a low risk now, but as these criminal enterprises see these devices that have all this information, they could do that. And this happened on a popular TV show. Actually, I won't mention the name. Yeah, well, I didn't want to spoil it for people who hadn't seen it.
I immediately thought of that. I don't know if other people watch Homeland.
So anyway, not that Homeland is a predictor of what's going to happen in real life, but maybe it is.
I mean, it certainly would seem prescient watching that. So, Josephine, you didn't get a chance to...
Sure. Well, I think all of you brought up some really important points. From my perspective, I think a lot about what kinds of defense you do at different stages of security incidents. And what sets medical data breaches apart in a lot of ways, I think, are this lack of kind of after-the-fact defense options. So Bob mentioned, after a breach of credit card numbers, you cancel them, the credit card companies are monitoring this. There's not really an equivalent for a lot of the kinds of medical health data that we use. And I mean, the reason in the context of a panel about why medical data breaches occur, I think that's important, is because data breaches occur for all kinds of data, right? Payment card data is being stolen all the time, Sony's email and everything they have is being stolen. So it's important to think a lot about how we could protect that data better, but it's also, I think, really important to think about how you make that data less valuable once somebody has it. And that's an area where I think the medical community has a long ways to go, right? If you look at, I don't mean to hold the financial sector up as too much of a model because they struggle a lot as well, but right, there's a lot of effort right now moving towards chip and pin credit card terminals in that sector. And the idea there is that you're going to, instead of having this one credit card number that's easy to steal and easy to use for all your purchases, you have a one-time transaction key that if it gets stolen isn't useful, right? So it's, again, trying to think about how do you devalue that data so you can't be selling it for 15, 20 times as much on the black market. And I think those are really interesting and important ideas to apply to Social Security numbers, other kinds of data, especially the kinds of data that come from the medical world, and say, what makes this data valuable? What makes it something that you can profit off of? And how do you try and actually scale that value back instead of trying to keep that information as secret as possible, which we know is really, really hard to do.
I'm curious, do you think the incentives are different in healthcare? I mean, I kind of mentioned one way in which they are, which is that the banks and the financial sector are responsible. And so that sort of encourages them. I'm curious as to, and anybody can answer this, is our regulatory and just sort of, incentive system in healthcare, is it working against or for consumers? I guess in some ways I feel like it's working against because hospitals or big insurance companies aren't really penalized. And they're also sort of not incentivized to be transparent. Because if they say, hey, yes, Anthem, we did follow HIPAA, then they risk getting fined in the millions of dollars. Does anyone have a comment on that?
Well, I think there's definitely less clear liability in the for fraud specifically, right? The credit card companies, you can't be held responsible as individuals for fraudulent charges over $50, and there's no equivalent to that in the sort of, somebody had this operation or claimed to have this operation under your insurance policy, and now you're being charged for some piece of it. I don't think we have any kind of legal protection there.
And actually, I went yesterday on the Hill, and that was one of the things that part of the conversation with the legislators came up is that we don't have like a healthcare FCRA equivalent, right? And I said, not that I want you to make that, but there is the issue, the financial part of it, the financial burden, whether it's fraud loss on the industry side or out-of-pocket cost loss on medical identity theft victim side, which is huge. We did a study and it was over $13,000 per victim on average. And so, I don't have $13,000 just to throw away because, I was a victim of medical identity theft. But the fact that we don't have that, so I think it kind of plays both. It's not, we say, is it penalizing or not? Is it pros and cons? I think on one side, the ambiguity, the lack of clear transparency about where the financial liability falls is difficult for patients, certainly. But I think then also it's an incentive on the industry side. If you are a healthcare provider, if you are a health plan, if you think you may be liable for huge amounts of fraud losses that you may or may not be able to recoup through identity fraud, then it would behoove you, whether you're legally required to reimburse a patient or not, or reimburse a health plan or not, to kind of prevent those fraud losses as much as possible, because there is no clear legislation or regulatory mandate that says one way or the other. So, I think in terms of, like, especially up on the Hill yesterday, on the incentive side of, we don't have something, and what kind of incentives would be good. I don't necessarily know if an incentive for the healthcare provider or the payer to do better privacy and security is the right kind of incentive. I'm thinking more maybe the incentives would be to kind of like Josephine said, the after the fact thing is that why would we not incentivize the industry to figure out if breaches are going to happen, that how do we fix it afterwards? Where's the incentives for the products or services that help the victims, on that end? Like, where are the incentives to do R&D in that space, as opposed to just telling the hospital, do better security? I don't know that incentivizing a hospital to do better security might necessarily actually reduce it.
Just real quick, so first of all, credit to Ann. Ann and I went up on the Hill a year ago after this conference, and we got 6 meetings on the Hill to try to educate a few people about medical identity theft and why it's such a big deal. This year we've got 26 meetings, and nobody turned us down. So it's a big deal with the regulators and the legislators. So that's the good news. Bad news is we got a lot of things that we've got to do to kind of shore this up. And, plug for MICA. If anybody's interested in helping this whole medical identity area, their big mission is to educate the consumers about medical ID theft. Because I'm telling you, 95% of this country, you mention medical identity theft, and they won't have a clue what you're talking about.
And I'm all for education, but I'm also for accountability. And I'm also curious about, is there any place on the Hill or within the FTC to, maybe not within the FTC, but to provide remedies? Is that one avenue here? And maybe that it includes some accountability, but it's something that my colleagues and I have been talking about. What would remedies look like for people who have suffered from medical identity theft? Bob, what do you think? What should they include?
Well, this is a little self-serving, but my mantra is, just like you mentioned, credit monitoring for financial identity theft, there's medical identity monitoring for medical.
I didn't know that until I spoke to you.
And so that exists. So the problem is, too many people aren't aware of that. And you've got this Attorney General for the state of Connecticut on the table telling CEO at Anthem, we've got to provide credit monitoring for all these people at Anthem. When he should know that credit monitoring will do virtually absolutely nothing to protect those people. And it's actually negative because the people are feeling like they're being protected and they're not. So,
yeah, interesting. Yeah.
It's funny, I feel like being at the FTC, health is not our primary, health privacy is not our primary role. We've kind of gotten into it because there's a lot of non-HIPAA covered entities that are collecting health information. But just from the outside looking in, I was listening to this discussion, and I've always envied HHS because they have the authority to get civil penalties if there's, security violations or other problems. And so I would think that would be a huge incentive for companies to maintain better security up front. And it's something that we don't have in other sectors.
Yeah,
so,
sure. Well, that's only been recently sort of given teeth. So I think maybe that is the case, although the fact that they're so ubiquitous now sort of makes you wonder, and the fact that it's so expensive would make you think that companies would sort of sit up and pay attention, and yet this is continuing to happen. So does anyone else have a comment on that?
So I think for government entities, one of the ones I think a lot about are the government-administered health services like Medicaid, right? One of the things that comes up a lot in these breaches is that Medicaid doesn't notify most of the people who are enrolled when claims are made under their name. And then there are a lot of reasons why that's not entirely easy to do all the time. But again, coming back to this credit card analogy, which I don't mean to abuse, right? You can look and see what's being charged on your credit card. You get, alerts sometimes. Right. And so I think there are even sort of small signaling changes that could help people detect some of this and remediate, which might be available to government entities.
Interesting point. I guess I'm curious about the FTC a little bit more. Just we had talked about maybe just some lessons that we can learn from some of your enforcement cases in this space, like the GMR case.
Sure. So I think the first lesson really is that HIPAA is not the only game in town. There are other laws that apply when companies collect health information. So there's the FTC Act, which prohibits deceptive and unfair practices. We also enforce a lot of other more specific laws, but just we brought many cases under Section 5, and just to kind of give you a few lessons, Michelle mentioned the GMR case. I think the lesson there is if companies are outsourcing health data to other companies, they need to make sure they oversee their service providers. So in the GMR case, we had doctors' offices and lawyers that were outsourcing transcription services, so legal transcription and medical transcription to a company in India. But they were not, the company in India was transmitting that data in clear text, unencrypted, over insecure servers to independent typists. And as a result, people found their medical records or psychiatrist notes online. And so we alleged that GMR didn't appropriately oversee its service providers. They told people that they told their customers, the doctors and lawyers, that they were going to maintain reasonable security, but they didn't. And so we were able to bring Section 5 enforcement action against them. I think another lesson, and I think Renee mentioned this earlier, is that one of the biggest source of data breaches in the medical community is mobile devices, so laptops, thumb drives, and other portable backup tapes and other portable devices. So we brought a case against CBR, which runs the cord blood registry. They had a data breach that resulted because they had unencrypted laptops and backup tapes and that sort of thing. And we alleged that they didn't maintain reasonable security over that information. So I would just, I think the lesson to companies is that, even if you may not be a HIPAA-covered entity, even if you are a HIPAA-covered entity, the FTC Act may also apply. And so there are laws. I think where I would like to see more incentives is, we've asked for legislation that would give us civil penalty authority over data security, but
Actually, I pushed for that yesterday too.
Oh, good. Thank you.
I didn't mention your name, but I said FTC needs better enforcement action to be able to.
Thank you. Thank you. So I think there's some lessons that can be learned from there. And then the last thing I would say is that, I know this is a panel about data breaches, but I don't want to lose the privacy issues, because I think a lot of the harms that could come from the release of this data are privacy harms. And so we brought a case against a company called Payments MD, which is slightly not directly related to data breaches, but what they did was they were a billing portal for doctors' offices, and they created a new PHR service for their customers, but they didn't tell any of their customers. They buried these authorizations saying, oh, you can go out to my pharmacies and my doctor's offices and get my information, gather it up and create a PHR. But they buried the disclosures. They went out to these entities, and we alleged that that was a violation of our law, and that was deceptive. So it's just, I don't want to lose sight of the privacy issues as well.
Interesting. One quick question, I'm not sure if you can answer this, but is the FTC looking into anything related to biometric data?
So I can't answer information about non-public investigations, but we've certainly been very interested in the area. We did a report on the facial recognition services that some companies provide, and it's been an area of ongoing interest.
Yeah, great. Josephine, did you have anything to add?
I'm trying to remember what the original question was about.
Well, we were talking a little bit about what we can learn from FTC enforcement cases, and then kind of shifting gears a little bit into what are the privacy harms, and what does the privacy violation actually look like?
Sure. Well, I think the harms question is also a very interesting one when you talk about medical data breaches, because usually there's a very clear-cut idea when you look at a data breach, or really any kind of computer security incident of, oh, this is obviously why somebody did this. They stole credit card numbers because they want to steal money, or they stole Sony's data because they want to shame them publicly and embarrass them. And medical data breaches are one of fairly few classes that I can think of that actually have a fairly wide range of potential harms. So you can be thinking certainly about financial theft, and we heard some pretty compelling numbers about what that looks like, but you can also be thinking about, is this data that I can use to somehow change people's lives, or change the ads they're served, or use this health information in ways that might violate privacy, that might affect their employment. And you can also be thinking about sort of health insurance fraud. Is this harm that's sort of indirectly financial, but really about trying to go after some kind of health service? And so I think I'm really glad you brought up the privacy piece, and also the fact that the question of harm here is very varied. And it's one of the reasons why they're hard to defend against, and why, as I said, sort of after the fact defense is hard, because you don't know exactly, am I trying to stop the cash flow to criminals? Am I trying to make sure nobody walks into a hospital and claims health care under my insurance? Am I trying to make sure I don't lose my job because of a particular health illness or whatever it is? And so I think that's sort of coming back to this question of how are these breaches different in a world where we see so many breaches and are not great at protecting against any of them, I should say, since we're sort of keep coming back to financial industry. One of the things that makes them challenging, one of the things that makes them important, is that there's really a wide range of things you can do with this data.
And the harm piece, I know, the survey that the MIFA organization just did, it is a 5-year, year-over-year. So this was the 5th year, but it was the first time we included, that we're not included in the 4 previous years. We didn't directly use the word privacy, but we kind of, alluded to it with the privacy information coming out, and we, how we couched it was with your reputation, and you mentioned employment consequences, and so we, kind of worded the question in, with your personal medical information being leaked out, or if that information was erroneous information because it belonged to the identity thief, but it was attached to you and that was leaked out, in what ways did it sort of protect your privacy, but for the negative kind of consequences? And definitely employment consequences, but, way high up on the list, like 80-something%, almost 90% was, just the embarrassment and the negative consequences of knowing that your private information, medical information, however it was used, whatever kind of harm it is, but that was now not private anymore. And so we started to look beyond just, how much money did you have to lay out to resolve the identity theft issue? How long did it take? We kind of looked more into the little bit more touchy-feely kinds of areas that goes into how you feel when your privacy is breached.
That's interesting, because the woman who spoke earlier today about her situation with her daughter, spoke about the shame that people feel, when sort of they're outed, I guess, in some way. And it was funny because she was saying, well, as a mother, of course, I felt like I was to blame, which I sort of related to that. But I think, that shame, I wonder if that's a part of why people sort of haven't made a voice for themselves in this debate. I feel like the public, is concerned, and when there are surveys, it's very clear. But I don't know if it's sort of, maybe it's both, that we haven't given them an avenue for their voice, or, that this kind of shame is at play, and the reason that people aren't coming forward or aren't sort of addressing their lawmakers about it.
Yes. So back on the question of harm, this is my hot button, because everybody I talk to about medical identity theft out in the marketplace, maybe not in this room, but nobody understands. And so I've gotten to the point where I say financial identity theft, we're in the business of remediating identity theft for individuals. Financial identity theft is a hassle. You got to get a new card, you got to go, but it's not. At the end of the day, we can clean it up in a few weeks and kind of restore your life. Medical identity theft can kill you, and I resorted to that because that's how I get people's attention. Because if somebody buys or steals your identity, your medical identity, and goes and gets medical goods, services, prescriptions, everything they get goes on your personal health record. And next time you go see a provider anywhere, that record's coming up and it's no longer you. So you can literally be misdiagnosed and have serious medical concerns.
1 in 5 get misdiagnosed or mistreated, or had experienced a delay in receiving their health care because there was confusion over what was actually is that really your blood type? Is that really your drug allergies? Do you really have high blood pressure or not? 1 in 5, that's a big number of people to potentially get harmful, health outcomes because an identity thief compromised your record.
I think I want to hear from Renee in just a second, but I'm curious about the sort of who are the victims of medical identity theft. And we've talked about it a little bit, but I'm curious about minors. And I've heard or read different things would say that minors are at great risk for being not just identity theft, but medical identity theft. Have you guys encountered this? Is this something that you've seen in your work? Anybody?
Actually, we did only look at the adult population, so our study only included, if you were under 18, we were deliberately excluded because we didn't have the bandwidth to look at everybody, so we look at just adults.
Well, when you look at adults, go ahead.
Real quick, what we see is the older population. question.
Really?
They generally-
Overwhelmingly?
They either don't get their economic benefits because they're on Medicare or Medicaid, so there's nothing to look at, or even if they're in the private insurance, they don't read them, they don't open them. So identity theft has gone on for years and nobody would ever know.
Wow.
I think just a related point to a minor point. We did a workshop on child identity theft, and I think what makes children's social security numbers most valuable to identity thieves is that it's a blank slate, and so they can associate a social security number that has never been used, and they can associate that with a fake name and address and get all sorts of goods and services from that without anybody being the wiser. So you only find out about that 18 years later when the child applies for their first credit card, or the teenager applies for their first credit card. But I guess the only thing I wanted to add is I think we've been talking about a lot of ways in which medical identity theft is like identity theft plus, and we've been talking about the plus factors, but I don't want to lose sight of the identity theft part. So we at the FTC, we get a lot of complaints about tax identity theft, and government benefits identity theft, and employment-based identity theft, and medical identity theft. But at bottom, they all involve a social security number, and so the advice is the same. Check your credit report. It's free once every year with the 3 major credit bureaus. Monitor your accounts because this information, no matter how it's gathered, no matter for what purpose it's gathered, it's an SSN that can be used for anything.
Well, I guess that brings up a provocative question that I've heard floated in some policy circles, which is, should we get rid of social security numbers? And I'm curious from the Canadian perspective, what your answer to that would be, or sort of how the system works where you are.
Right. Well, I mean, certainly you're not meant to use our social insurance number for as many things as what's used in the United States for the SSN. And certainly, I think this whole conversation just amazes me as to how pervasive the SSN is. And looking through some of the data breaches, the healthcare data breaches, I was reading through all the data that's actually taken as name, date of birth, address, email, telephone, SSN, bank information. They've got everything for all of the. So why do they have all of this information? Why does one organization need to collect everything? To me, this seems like the industry has to go, to distributed systems and federation. And sure, there are authoritative sources that have your SSN, the issuers of your SSN, those are authoritative sources. So why not go back to them for validation of that SSN when you need it, as opposed to, I'm going to write that down and I'm going to store it in my unencrypted database on my network.
Can you talk a little bit more about what federated system is all?
Sure, yeah, absolutely. So basically we've got a variety of authoritative sources on, your Ministry of Transportation in Canada. At least that has our driver's license number. Your healthcare Ministry of Health has your health number, issues your health number. So those ministries should maintain the control over those numbers. And the individual maintaining the control over who has access or who you allow to validate against that. Basically, if we think about someone going in to buy alcohol, so you have to prove to the liquor agency that you're over 19 in Canada. I don't know what the age is. That you're over 19 in Canada. So you pull out your driver's license and you show them. So now they have the person who's standing there has your name, address. They can see that you're over 19, but they've got everything else. So in a federated system, I would tap a card on a reader that will go back to the Ministry of Transportation and say, is this person over 19? And they'll come back and say yes. So I think there was a discussion on that in an earlier session today about we should be dealing in answers. Is this person able to buy alcohol? Is this person over 19? Yes. You don't need to know what my date of birth is and my exact year. You need to know, am I over 19? And so basically this way of moving forward with authoritative sources, and when you need information about that, you validate, you ask the question, is this the right, are they over 19? You can do that throughout whenever you're dealing with data, as opposed to lumping name, date of birth, social insurance number, everything into a single database.
It's a huge cultural change in the U.S. though, because we have gone down that, we went down that road of everybody has a unique identifier. It was meant to get retirement benefits, but if everybody's got rather than create a new system, right? We just started using it, back, states, I don't think any states anymore use the SSN as your driver's license number, but, originally, driver's license numbers in a lot of states was the SSN itself too, and, with the SGR fix, it'll come off of Medicare cards here shortly, kind of thing. It was on the VA cards, health benefits until last year. So that was an easy way because a number existed to just use that number any other time you needed an identifier for a person.
Right.
And so decades of that, I do think it's a culture change to move away from that. And so actually last week I had 2 doctor's appointments. Both doctor's appointments, they asked for my SSN. I wrote a little snide comment on there. One doctor's office was not, they didn't think it was very funny. The other one, I know the person who works there, so she was like, I get it, that's your job kind of thing. But it doesn't, my question was that, do you need that to give me health care today? No, you don't. And they said, well, that's how you're in the system for us to track you down, to validate your identity. I said, there is just, in this day and age, in 2015, so many other ways for you to validate who I am, to give me health care. That is not what you need to do that, and so they did. We argued a little bit at the front desk there, and, of course they let me go, but it is a culture change because the registration employee, she just could not fathom that, what is the big deal? We all ask for this. Everybody gives it to me. Why are you giving me grief about it? So it just was, even if she agreed with me, yeah, that's kind of sensitive, but it's this culturally, she couldn't wrap her head around, why don't you give it?
I was asked to sign my son up for Little League, and
Your number or his?
His number.
I don't give my kid's number to anybody.
But I think that I think there's a certain element of trying to put the genie back in the bottle. I don't think we can completely eliminate the use of Social Security numbers. I do think that we can reduce the supply. So I think reduce the availability of Social Security numbers. So I think getting them off of the driver's license is key. I think getting them out of court records is key. I also think that we need to develop newer methods of authentication. So you mentioned biometrics. I know a lot of companies are doing challenge questions, which actually has been called into question. But biometrics, tokens, other forms of two-factor authentication. So I think that is something that we need to do so that we can reduce the value of SSNs if they do get into the hands of identity.
Anyone else have a comment on the Social Security question? Okay, I think we have a few minutes here before the end to take some questions from the audience. I think I saw your hand first, Doug.
Yeah, a question. Is cyber terrorism a discussion or concern as part of this conversation?
Absolutely. I mean, the Poneman study, what it showed was not only 125% increase in hacks into healthcare records, it's actually emerged as the #1 reason healthcare records have been compromised in the last 12 months. So.
And I asked that question because we just had a long discussion in that
Well,
we had a little bit of a different frame on our discussion, just by virtue of what we were kind of focused on.
And honestly, everybody's kind of scratching their head as, what are they after? If it's state-sponsored terrorism or cyber terrorism,
Right.
What are they really after?
Right. I mean, I think it was revealed that the Anthem data breach was a Chinese government-sponsored activity of some kind, and the motivation was apparently to figure out who were the Lockheed Martin contractors, and work to find out their diagnoses, and I guess somehow infiltrate in that way. To me, that seems like a less likely reason, but obviously really concerning.
Psychological disruption if I'm a country that wants to create havoc on
True.
country. I mean, this would be some one way to create panic within a country. And that's why I just
Certainly.
how high a level of conversation is.
Well, I think it's, the low-hanging fruit part matters, right? The fact that a country like that would spend the time to try to infiltrate a system like this is very telling.
Well, I think, okay.
Whomever.
Just a comment. While in the U.S. I know SSNs is a big deal and we're all trying to move away from, use of Social Security numbers, However, Professor Haribe, this morning he mentioned something about implementation of a national number system which would identify each Japanese citizen. So that's kind of, it's here in the U.S. we're trying to move away from that, and they're going to be implementing that starting January of 2016. So that's a very interesting, comparison there. With the Social Security numbers, I do agree, biometrics plus, like some unique questions, security questions, that would be an excellent way to do it. However, I know there are so many systems, especially within the federal government, they are heavy users. And working in the Department of Veterans Affairs, we are actively, trying to reduce the usage of Social Security numbers and eventually trying to replace it. But then the question comes up, what do you replace it with? Another numbering system, which would be akin to the same problems that the SSN has right now. So that's something that I know everybody's trying to wrap their heads around and come up with solutions, and hopefully we will come up with something with the technology the way it is in this day and age.
Well, I'm curious, when you say you're working to reduce the use of it, what are you doing to try to reduce the use of Social Security numbers then?
For example, in certain systems, in our IT systems, we might be using the full SSN right now. So instead of using the full SSN, we are truncating it to just the last 4.
Well, I also remember when I started in the federal government, and every time I filled out a leave slip, I had to put my SSN down on the leave form. And I think somebody said, well, why are we asking for that from our employees? I think sometimes it's just a question of saying, why do we need this? And then, and so now, it seems like a quaint example now, but, it was pretty ubiquitous when I started.
And in certain systems, for example, when we send out appointment letters to our veterans, it used to be you would have the full SSN right on that letter. Is it necessary? No. So therefore, we eliminated it completely. We don't have it there anymore.
Right.
In the ID cards for veterans, we have the SSN just hanging right out there on that card, and we've eliminated that as well. Okay. So we're looking at various ways to either eliminate or reduce the use of SSN.
Yeah.
So, good. Thank you. A couple of points. One, in hospitals every day, we perform 3rd hysterectomy on women, 4th hysterectomy, literally millions. And we perform a 4th hysterectomy on men. We get all the data wrong. We perform operations on people who have died years ago, who died last week. We perform operations and give inoculations to people who haven't yet been born. And so we have all of these screwed up names and numbers in our hospital systems, in part because we don't have a unique ID, patient ID. And I recognize that that's a joint issue, a two-sided sword, but it's pandemic in healthcare institutions. And it also means that we treat people with the wrong drugs because we think they're somebody else. At this moment in Houston hospitals, according to a colleague, there are 3,000 Rosita Gonzalez's. And the probability that some of them are sharing numbers and the like is not insubstantial. In addition, hospitals and healthcare systems have very unique problems. Everybody needs potential access to healthcare records because we don't know what's going to happen. And we have residents who are rotating every 30 days into a new service. We have nurses who we've hired on a rotating basis and the like. So it's really hard. And just last, there are in every hospital system about 300 separate IT systems, and each of them have to communicate with the electronic health record. And some of them include outside pharmacies and outside labs and inventory. And so the reference to financial institutions is sort of irksome because healthcare institutions have a hell of a lot more difficult settings because people aren't fungible, whereas money is. And, $15,000 is $15,000. But your healthcare record, twisted slightly with your neighbors, is lethal. And we face that constantly, along with total open access in some circumstances. So,
thank you very much for that comment. An interesting perspective.
Comment against that. So in terms of, We've brought up financial services a couple of times, but understanding what's unique about medical identity theft and, the consequences there that's different from financial ID theft, and what's unique about the healthcare system. How does a hospital run? How does a health plan or payer, how does the business run on a day-to-day basis? Your primary mission is to, keep me healthy or make me healthy, not let me die. But obviously, administratively, there's things like identity management that goes along with that, and so they have to understand that. And I think that's one of the things that the bad guys, the crooks, do a whole lot better than us, is how well they understand how things work. So, to their benefit, they obviously don't have to follow any laws like we do, right? They get to say and do whatever they want, however they want, kind of thing, and we are working in a different kind of confines. But to the extent of this understanding and organization, criminals are highly, highly organized. That's why it's called organized crime. They get together, they share information. We do a little bit, we don't do that so well sometimes in some situations, and particularly in healthcare, for instance. And I don't know what Renee's experience has been, but one of my big sort of pet peeves has been is within the enterprise, how many of the identity management folks and the fraud folks and the healthcare providers and the administrators, like within our hospital system, do any of you guys talk to the CSO's office, or what's your relationship there? Do you understand what they're trying to do? Do they understand that if you're a doctor, this is the kind of data I collect and how it's stored, and if you're a nurse, this is how it is. If you're a resident that turns over service every 30 days, this is how that works. Like, does the CSO's office understand that, or how much enterprise collaboration is happening? And my guess is that it's not happening as good as we could be making it. That we could organize ourselves a little bit better there with the information sharing.
Thanks, Ann. I think we have time for one quick question. Yeah, and then because he's been waiting for a little while. Go ahead.
Thank you. Neil Bampton, I've come over from the UK to understand some of the challenges that are faced, and I'd like to thank you for a really good panel discussion. Interesting for me is around that federated hub approach, with the SSN number being such a key to open every door for every citizen in the United States. That layered approach of identity, we've pigeonholed, from my view, financial crime, medical crime, into different boxes. It's actually the same thing. You've got a key here which enables you to access virtually everything. If I can get hold of that SSN number, I can get hold of your your medical data, your financial data, and go through and really, really impact your life. So looking at federated hubs in terms of diversity and creating layers of verification around identity will give you some form of protection. And those layers go into a number of different things. And interestingly, you talk about secret questions. We've found in the UK, banks are compromised now by KBA. Absolutely so easy for a fraudster to come in and get into the credit reference data and actually answer those questions very easily. So I work on a project in identity assurance for the government in the UK, and it's looking about how UK citizens get access to services that are going to cost the government money in terms of their digital forum, and basically enabling citizens access to those services in the right way. So we look at federated hubs in terms of giving access when needed to, like you say, driving license data, passport office data, that gives reassurance in a layered approach to protecting the individual and also the organisations.
Great, thank you so much for that comment, and please join me in thanking our panel today.